This is Selma Schimmel for the Group Room at the annual San Antonio Breast Cancer Symposium, joined now by Dr. Julie Gralow, the Jill Bennett Professor and Director of Breast Medical Oncology at the University of Washington and the Seattle Cancer Alliance, also a member of the Fred Hutchinson Cancer Research Center. Hello, Dr. Gralow.
Hi, Selma.
I know that when we get cancer, oftentimes we get very close to our medical oncologist, and our internist or general practitioner may become less active in our, we forget we have other issues we need to follow, and especially as we get older, cardiovascular issues.
Absolutely.
We're women. So I'm just wondering about the safety of women who may have, let's say, a clotting factor, or I remember when we got BRCA tested in my family, we all were also tested for Leiden factor 5.
Right.
And my sister has that, and when she developed DCIS, they decided based on that knowledge she would not be a good candidate for tamoxifen.
Right.
And it's always been on my mind wondering, well, we have that information because when we went through our genetic testing, that was included. And I've always wondered why, if a woman is going to be possibly given tamoxifen, why wouldn't we want to know more information about her possible predisposition? And if she has, let's say, a clotting factor, maybe it's a silly question, but now with the thought of putting a patient on 10 years, how relevant to you as a medical oncologist would it be to know if someone does have a predisposed issue relating to blood clots?
So as you bring up, clotting is a risk of tamoxifen. If you look at where they occur, it's older women, women over 50. The older you get, the more the risk of blood clots and the pulmonary emboli and strokes occur on tamoxifen. When we did the tamoxifen prevention trial, which was 17,000 women, when we looked at women under 50 and premenopausal women, we really didn't see an increased risk of clots from tamoxifen. So that's one answer. The ATLAS trial included women of all ages, so if you look at the side effects, you really need to carefully look at who is premenopausal and younger, because we've got good data that the side effects of tamoxifen with respect to the serious side effects like clotting and uterine cancer are almost non-existent. They're just the basic background population. So your question about the inherited risk for clotting, the factor V Leiden deficiency, that is rare. I'm not quite sure why it was done in your family unless you had a history in your family. Yep, so there you go. So it's really rare. It's very appropriate it was done in your family. So I would say to a woman, if you have a history of clots and things in your family, absolutely, your family should be tested for an inherited clotting factor problem. But it would be so rare that to test the general population or to test the average breast cancer patient, the likelihood of finding it would be so low if you didn't have a family history that it's not recommended at this time.
But it's an important question for women to know. No, get your family history.
Absolutely,
because some of the drugs that we use based on our family history could make us more vulnerable, but these are the little things that would empower patients to have better control of their health and overall care.
Agree. So we want to empower patients and we want them to understand all the side effects of a drug. So Selma, I agree that knowing that clots can be a side effect of tamoxifen, although rare if you're young, that knowing your family's history of blood clots might be part of your decision.
And you know, ironically, while my sister and I are both BRCA positive, her 4 daughters are negative, but 2 or 3 of them did test positive for the clotting factor.
Oh, interesting.
So that's not the BRCA mutation, but
all 4 of them are negative for BRCA.
Yeah, that to me, and to me it's an inspirational story for women to know as well, because women who do have children sometimes are so afraid that, am I going to pass it on? Well, there's 4 daughters here. Thankfully, we know who's predisposed to clots now, but the breast mutation that took my mother and my grandmother, and now, I'm ovarian survivor, ends with my sister and with me, at least for our part of the family. And there's something really fantastic about that this horrible legacy is over because her daughters are all negative, and I
Yep.
think it's remarkable.
Yep.
Thank you, Dr. Gralow. I love our overviews with you. You touch on so many important things, and your research, awfully important.
Thanks for having me, Selma, and thanks for everything that you do for all of your viewers.
Dr. Julie Gralow, the Jill Bennett Professor and Director of Breast Medical Oncology at the University of Washington and the Seattle Cancer Care Alliance, also a member of the Fred Hutchinson Cancer Research Center. Thanks again, Dr. Gralow.
Thanks, Selma.